CBS Atlanta News presents Public Affairs on Peach.
From carpool to playdates to managing a family's busy schedule, it's easy for us mothers to get caught up in everything we have to do. Research has shown, in fact, that women spend so much time caring for other people, their families, that they end up neglecting their own health. Welcome to a special edition of Public Affairs on Peach. I'm Stephanie Fisher. Thank you for being with us. For the next 30 minutes, we're going to be talking about health issues that we as women face every day. Our first guest this morning is Dr. Montgomery Rice, the Dean of Morehouse School of Medicine. Thank you so much, Doctor, for being with us today. We appreciate it.
Thank you for having me.
The new Affordable Care Act has a section of preventative care for women that must be covered without a copay, without a deductible. What all does that package entail? What does that cover?
So for many of us, when this passed in March of 2010 and then became effective in 2011, we started to see where women didn't have to have copays for mammograms, some pap smears, some of the basic things that we think that women should go to the doctor and have every year that prevent disease. And now we know in 2012 that's going to extend to domestic violence counseling, family planning, breastfeeding counseling, all of those things that become a very integral part of our life that make us healthy and make us able to be everything for everybody.
To do all the things we need to do.
Exactly. So we're really excited about that.
Why is this coverage so important, do you think?
You know, it's important because when you look in 2010, there were about 20% or 16 million women who were uninsured. There were another about 16 million women who were underinsured. And when we look across the state, just with the Affordable Care Act, once it comes into full fruition, we're going to see a significant reduction of about 20% of women uninsured or underinsured down to 8%. So again, most of those preventive health care services are going to provide the opportunity to prevent disease before it starts.
Doctor, it's interesting that you mentioned this is going to cover domestic violence, interpersonal issues for women, and these things are so important for a woman's well-being, to be able to manage herself, her relationships, and so therefore she can manage her family.
If we look at just smoking cessation alone, if you look at the surveys, most women smoke because they are trying to lose weight or because of stress or for whatever reason. Just giving women an opportunity to decrease their chances of smoking by putting them on a program that's going to integrate itself with other preventive services. We believe, of course, that's going to decrease long-term health consequences like lung cancer, emphysema, or chronic obstructive pulmonary disease.
We always hear, at least in the health field, that men are the ones that don't go to the doctor, don't take care of themselves. But really, we're talking about women who may not be taking care of themselves. Do you think it's more that they're not aware of it and that they don't want to, or is it simply they just don't have the time?
Again, I love evidence. 2010 study came out from the Commonwealth Foundation, and what it showed was that about 52% of women in this country said that they had skipped going to the doctor because of the additional copay that were involved with getting a pap smear or mammogram. And that's compared to, you look at some of the other countries like Switzerland, where that was down to 7%. So a large part of it was women having these copays that were going to prevent them from receiving the care. I always look at, you know, when you think about a woman's pregnancy, women want to go to the doctor. They're sometimes concerned about the information they may get, but if we make it easier access for them, we know that they're going to go there and provide their child and themselves with the best care.
You are a renowned fertility expert. It seems to me, and maybe it's my imagination, that we're seeing more women who have trouble getting pregnant. Why do you think that is? What's happening?
Well, you know, women definitely have more choices for careers. Women are making more informed decisions about whether or not they want to get married. And what we're seeing is a delay. You know, about 15 to 20% of women will have some problem potentially with getting pregnant. Most women that resolves in the first year. But if you get beyond the age of 35, we see that number go up to 20 to 25%. And so I believe it's because we're seeing the delay in women deciding to have children. But that's an okay thing because women are making more informed decisions. And that means hopefully that when they do decide to have kids, they're going to be healthier parents, not just because of the physical attributes that they have, but because of the mental capacity they have also.
Doctor, what can we be doing, though, as women who are heading into our 30s and possibly early 40s, if we know we want to start a family down the road? What can we be doing to keep ourselves healthy and make that still be a viable option for us.
Those preventive health services make a difference. So if I had to tell women one thing that they would do to make themselves better prepared to be pregnant, and that is to have a healthy weight. Okay, that's not meaning that you should be a size 6 or a size 2. That means that based on your body structure, your level of activity, your cardiac output, good, you should be healthy. And that means that we have to really watch what we eat, exercise 3 to 5 times a week, and really decrease our fat and carbohydrate intake. Balanced diet, balanced life makes you more mentally prepared to also be ready to have a child.
Going back to preventative care, do you think that women maybe avoid getting pregnant or starting a family because they feel like they can't afford it, that it's too expensive?
You know, that has not necessarily been an issue in this country that we have seen. I know that women have been concerned about whether or not they're going to be able to receive the optimum level of care during their pregnancy. We now also offer, and to see this as a part of the Affordable Care Act, preconceptual counseling as a part of the family planning continuum. You know, a lot of people tend to think about family planning just as birth control. It's not. Family planning is when is the right time in my life, based on the circumstances beyond my health, but my mental well-being, on when I should achieve a pregnancy.
Dr. Montgomery Rice, thank you for your time today and your expertise. We appreciate it.
Appreciate it. Thank you.
When we come back, we're going to take a look at some specific health topics facing women. Up next, the potentially life-threatening heart rhythm disorder, atrial fibrillation. What is it, and why is it so deadly?